Hi, welcome to the channel. My name's Scott Spiers, licensed clinical addiction specialist and clinical supervisor here in North Carolina. My favorite thing in the world to do is exam prep, so I thought I'd throw out a video to clear up some misconceptions and some ideas about the IC and RC alcohol and other drug counselor exam and a little bit on the advanced alcohol and other drug counselor exam. It's my favorite thing to do in supervision. I've been a teacher. I just love this stuff. So give me a few minutes and let me share why I love this stuff so much. Now, a little background on the exams. First, if you're taking the ADC exam, keep in mind this is for certification. And certification, if you have a GED, a high school diploma, or the equivalent, you meet the basic qualification to be a certified alcohol and other drug of abuse counselor. Um, when you're certified, it means that you can conduct individual sessions, you can do group sessions, you can perform documentation, and you need to understand each of the 12 core functions of addiction counseling. In some states, in some circumstances, as a certified counselor, you're certified to do assessments, which is a core function, and diagnose provisionally substance use disorders. The advanced alcohol and other drug counselor exam, that's for master's level clinicians. They have a master's degree in addiction counseling, which is what my master's is in, or social work, mental health counseling, marriage and family therapy, and even pastoral counseling. I'll address those things. I'll go into more detail in another video on the AADC. But for right now, the biggest difference between them is the advanced is going to focus even more on co-occurring disorders like anxiety, which I might feel a little right now, depression, personality disorders like borderline personality disorder, narcissistic. So there are going to be more questions on those exams on co-occurring disorders. Also, there's additional ethics in the advanced exam because you're licensed, you're practicing without a clinical supervisor. So they want to make sure that you understand ethics and especially things like HIPAA, all of the rules and regulations that go along with it. And in the advance, there's going to be some basic supervision knowledge being tested because as a licensed counselor in most states, you can actually supervise fully certified counselors. So that's the big difference between the two is the focus on the advanced is more on independent practice stuff. So as I mentioned earlier, I've been training counselors for the ADC and AADC for this is starting my 9th year. In that time, I have seen some common mistakes that counseling interns make when they're preparing for the exam. These observations, they're based on my experience, not on analytical data. I'm not the expert. I'm just a dude who's seen a lot of people do a lot of things, and my favorite thing is to work with them and kind of fix those little things. And I'll just say very high success rate. Um, this this here is not a substitute for clinical supervision. Other opinions out there are just as valid, even more valid than mine, especially if they have analytics behind it. Uh, in almost every case that I'm talking to someone when I'm coaching, I always defer to the clinical supervisor if I say anything that's confusing or that you disagree with. Let me know in the comments. But most of all, if you're a counselor, especially an intern, go seek supervision on this stuff. The first mistake that I see regularly, and it usually comes out within 2 minutes on a free phone call with me. By the way, I do a free discussion with prospective coaching clients. Um, I do a free phone call, and what I usually find out is the method they use to prepare for the exam is doing practice test after practice test after practice test, which that's cool and all, but The ICRC on their exam questions, they are rigorously tested every year for, is it applicable? Are they showing any sort of cultural, racial, or gender bias? And a whole bunch of other factors. Like, they want to make sure that they have good internal validity and that question is representative of the field as a whole. Practice exam questions, they don't have the same rigor as testing. Anybody can make a practice exam question. And the only thing I can really guarantee you is if you're coming across things in practice exams, that pretty much just guarantees that that question is not going to be on the practice exam. That being said, I've known, for every one person I know who doesn't pass the exam because of the practice exams, there's at least 10 that did. So if it's working for you, then let me throw you off your game. This presentation is more for people with exam anxiety, with they really don't know where to start. They're not getting a lot of guidance, and for people who have failed the exam. And again, more than half of the phone calls I get for coaching involve people who you need 500 to pass the exam and they get 496. So if it works for you, keep doing it. Don't let me or anybody else throw you off something that's working. Now, practice exams, they're necessary tools. And the way I personally have prepared for exams and the way I guide other people to do it is take an ICRC exam, practice exam, they're $50. Take that before you begin studying, and it's going to give you a baseline reading of where your knowledge is at. Pick your date when you're comfortable, and about 30 days before you take that exam, that's around the time that you want to take another ICRC practice exam. Those questions are, but those are practice questions. They put them on the practice exam, and if they perform well enough, eventually they grow up and they end up on the big boy, the big kid exam. So that's my recommendation. But again, if practice exams work, by all means, keep doing it. The second mistake I see is trying to read everything everywhere all at once. Random flashcards, preparation sites, and yes, YouTube videos like this can distract and confuse you. So my recommendation, focus on the actual domains of the exam. There are 4 domains on the exam. The first one is screening, assessment, and engagement. Now, these are loosely written, but screening, assessment, and engagement. Do you know the difference between screening and assessment? Which, by the way, that's the tricky sucker right there. Because if you're basing it on what you do on your day-to-day, right? Typically, a prospective client calls, "Hi, I need some help." So you say, "Hey, yeah, come on in." And then screening and assessment and usually treatment planning, it's all happening like all at the same time, including intake. So it gets confusing. Keep in mind the 12 core functions, they treat it as if everything is separate. If you're working in the real world, screening, intake, assessment, and treatment planning, it kind of happens like all in the same hour and a half. The second domain is treatment planning, collaboration with other professionals, and referrals. So in this, you want to know things like what a SMART treatment plan, what treatment plan goals there are. They might throw a trick question at you, especially in the scenarios where they have you doing treatment planning before you do intake. So you want to be able to know these things in order. Domain 3 is counseling. There's a lot of counseling theories out there. So my recommendation has been to focus on the counseling therapies that are used in what's called Project Match. And I'll do another video at some point on Project Match. But those are going to be cognitive behavioral, motivational enhancement, rational and emotive is another good one to have, and 12-step facilitation. So those are the biggies. Of course, there's going to be a question or two about Gestalt, maybe about dialectic dialectic behavioral therapy. Um, yeah, there's so many to list, but in my experience, if you focus on the basics, cognitive behavioral therapy, motivational enhancement, 12-step facilitation, you're probably going to know enough to squeak by and pass that exam. Finally, and not lastly, professional and ethical responsibilities. So this is where you want to know HIPAA, you want to know federal regulations, state regulations, which takes precedence. Those are the things that you're really going to want to know. So focus on the domains, man. A lot of people, they memorize the wrong things, right? They go to great pains to memorize who made up what theory, how do you apply this theory, and all that. And I think a lot of times we kind of forget that, oh, this is an addiction counseling exam. So these are the things that you absolutely positively want to memorize in order. The 12 core functions of addiction counseling, again, in order. The DSM-5 substance use disorder criteria, in order with what's called the core specifiers. And I'll have more material on that down the road. Finally, you want to know the 12 steps of Alcoholics Anonymous, Narcotics Anonymous. And if you want to get picky, if you're doing 12-step facilitation, you want to really have a firm understanding of the first 4 steps. Also, there tends to be a lack of understanding of substances of abuse. For instance, if you've been watching YouTube and paying attention to the news and keeping up on everything, dopamine is the root of all evil. It's dopamine, dopamine, dopamine. If you think that dopamine is the primary neurotransmitter with all drugs, you're probably not going to pass that part of the exam. There are numerous neurotransmitters. That's how drugs work, is they activate, they deactivate, they mimic existing neurotransmitters and hormones, such as endorphins, serotonin, adrenaline, norepinephrine. So you really want to have a basic understanding of drugs of abuse and how they work. I will, as always, have more recommendation and books and other material in future videos on how to get that basic drug of abuse education. I have 3 basic strategies for passing the alcohol and other drug counselor exam, the advanced alcohol and drug counselor exam, and this even works for the certified clinical supervisor exam. There's a lot more that we can go over, and I will, because I love talking about this stuff, but these are the bare minimum basics that I use when I'm working with people to pass the exam. Memorize the 12 core functions. Memorize as much as you can the global criteria. And when you walk into your exam place, I never recommend taking a non-proctored exam at home. Computers break, internet goes, there are issues. I always recommend go to the facility, and they're going to give you a piece of paper and a pencil or a pen. Before you even start answering questions, write down the 12 core functions in order. 2, memorize the substance use disorder criteria and write them down before you take the exam. Finally, have the 12 steps memorized, and on that sheet of paper, you want to write down the 12 steps of AA, NA, or whatever. There's a bunch of reasons for this. 1, it'll help alleviate test anxiety. 2, it's really hard to be reading a big, dense paragraph and keep track in your head. It's hard to remember that stuff. So write it down so you don't have to guess. And when you're reading along, you can go, aha, they skipped the portion on assessment, or aha, they skipped the portion on orientation. And you really want to understand what those things are. Honestly, if somebody has failed the exam with a 496, this is usually where it's happened. So write them down. It's perfectly legal to do so. Don't bring in any cheat sheets. Don't cheat. There's no reason to. It's not that hard. In my experience, it's really helpful to have that information right next to you so you don't have to think about it when you're sweating. One last thing, and I'll throw that this is a bonus. This is a bonus. When you come across a question that is just stumping the heck out of you, let it go, move on to the next one, because you have a certain percentage chance that you're going to have a question, 25, 30 questions later, that the first part of the question is the answer to the question that you were missing. So just keep track of the questions that you don't understand. Don't let yourself get freaked out. There's a really good chance that another question in the exam is going to make you go, aha, that's what that is. Then you go back, correct it. And so breathe, do everything you can to know your stuff. And that's really essentially it. The other recommendation I have is if you want to write down basic drug information before you start the exam, by all means do it. They're giving you paper, they're giving you a pencil, make use for it. That's all I have right now. Let me know in the comments if you like this, if this was helpful. And what I really would appreciate is information on what do you as a counselor need for support on YouTube, on my channel, or anywhere else. As always, thank you for watching this all the way through. I really appreciate it. I hope this helped. And go study, go. You know now you know what to do. Go do it.